Hello everyone, hope you can hear me well. We are starting the social media orientation for state, district, block, and IC nodal of block level officials, as well as state nodal officers for CP, CPHC, and IC. I welcome you all for this social media orientation workshop, which we are having. As you know, that in current times, social media is really important to. I mean, it's important to do work on field, but it's also important to showcase your work, whatever you are doing, whatever hard work you are putting in on social media. And I would also like to inform you that we have ABHWC handle. Ministry also have MOHFW handle, and all these handles are there to showcase our work, whatever it is going on in the field. So therefore this social media workshop was orientation workshop was planned for all of you, and we really want active participation, not only from state, also from district and from block, so that our handles can pick up pace and have more number of followers, and it can reach to masses. So starting with this workshop, we will be covering various topics today, like basics of social media, orienting you on Twitter, Facebook, and how to set up Facebook pages, Twitter pages. You can also open your state accounts if they are not there, how to use these accounts, how to add hashtags, how to tag, and how to use Instagram, and what are the do's and don'ts. And we often ask you for photographs, good quality, high resolution photographs, videos. So we would also tell you like how to click a good better picture from what you are clicking, because on social media and at other platforms high resolution pictures are required. So we'll be focusing on that as well, how to take a good picture and a video as well. So we would request all the block level officials, you should tell your block level officials to join our YouTube streaming. And now I would like to invite our advisor, sir, Dr. Balasubramanya, to give you an orientation and on why this workshop was planned, how we are going ahead with this. So I invite you, Dr. Balasubramanya, to give your welcome address.
Thank you, Dr. Tarunam, and thank you, MSL team, for ensuring that this program gets onto the ground. And today actually is a very important day for all of us to understand what is the role of social media in our own lives, in both personally as well as professionally. Because social media has become such an integral part of day to day living in this world that each of us needs to be equally equipped to ensure that we become part of the world and we are able to contribute as well as learn from that world. So, we are taking this opportunity to bring it to your understanding, and that too on a hands on workshop, to see how what are the different social medias that exist, how it can be actually used, and how each of you one can actually propagate your own thoughts and ideas on one side, as well as actions that you undertake in your professional front, but also use media to get updated on various accounts for what is happening in and around the world. So in that context, the social media class is not about only what we are doing today. It could be useful even for your personal life, because you will understand what you can do and how you can leverage it for your own benefits. Any instrument that brings into the world is like a knife. It's a double-edged sword. That means if you use it well, it makes your life better. If you abuse it, it will affect you badly. So the tools that are being educated to you is with respect to those things which you can use appropriately, so that it enriches your life, both personal and professional, and also avoid getting that abuse you as well as you abusing it. So in that way, a sane interaction with the social media is what is expected. Incidentally, all of you being healthcare professionals, you also have a lot to say with respect to the work that you're doing. And especially because all of you are involved in primary healthcare, the primary healthcare can only function when people that you serve are empowered and people you engage with trust you and the facility that you work in. So, this process is basically to ensure that all people get engaged, empowered, and build a rapport or a trust between people and the provider, so that overall we would be able to ensure better health and health services for all in this country in our mission for universal health coverage. So, Aishman Bharat Health and Wellness Center is all about universalizing this spirit of better health seeking behavior. So you need to educate them, and how can you use social media to educate your people? It is also about educating ourselves, because we learn from the people, we learn from others experiences. So how to use the social media to understand how a person in Ladakh is able to do something, and a person in Meghalaya is able to learn about it and implement it there. Similarly, a person from Tripura could educate a person in Karnataka or even Andaman to ensure that how they would be able to emulate the practices that are happening in Tripura in their own places, which would actually ease your job of doing, gives you more ideas to flourish, and that might enrich the way you engage with your community, and the way the communities that you serve start trusting you and respecting you. I hope today's session would give you an insight about using social media as a tool for this universalization of healthcare. So I call each one of you to ensure that you actively engage in this session, so that you understand the nuances of using social media for benefiting you and the community at large. Thank you.
Thank you. Thank you, Dr. Balasubramanya, for an introduction and your opening remarks. So, I welcome MSL team. There are two people joining from MSL team who would give us the brief and present and undertake all the activities. We are just putting agenda on the present. I mean, on the screen, so that you all can see what all topics would be covered.
No.
Thanks, Dr. Shiny, for putting up agenda on the screen. So now we'll. After the opening remarks, we'll orient you on social media platforms: Instagram, Facebook, and Twitter. All of these platforms have our ABHWC handle. After that, it is important to make this session, as Dr. Bala has already pointed out, to make it more interesting and interactive. You can ask your questions. There's a session there is time kept only for question answers, and during that 1.5 hour almost, we are going to have multiple activities. How to open an account, how to use social media accounts, how to like post, and how to post pictures, how to add hashtags, and all the undertake how to undertake all these activities. You all can actively, it's expected that you all actively participate in all these activities and make this session as interactive as possible. After that, as I've already said, that there'll be a discussion on how to click good pictures, better pictures on and videos for social media. Then we have a surprise for you, that we'll be creating social media ambassadors from each state, who would have certain roles, responsibilities, and privileges. After that, we'll have a comprehensive question answer session. During these activities, also, if you have some questions, feel free to ask. And as we have made all of you as panelists, so you can ask your questions, put your question on chat box, and then and make this. I would request all of you to mute yourself. So I hand over the stage to the MSL team, Miss Asta and Miss Vidhi, who will be taking up the presentation. Thank you. I would request your block level officials to tell your block level officials to join YouTube live streaming. As we cannot accommodate so many people in this meeting, so many of you can your block level officials can join the YouTube live screening, and they can also post their comments and questions in the chat, and we'll be taking up those as well. Okay, so handing over now to MSL team.
नहीं चाहिए होगा ना कुछ और भी खिलाना पड़ेगा प्रॉब्लम मुझे से अलग करके
Ya, yo me digo de Roma, no sé por qué. Cuando tengo bodas, yo pues. Etiqueta. Toronto. Etiqueta.
Itu muncul jasa tadi pada.
Can't hear anything.
Hi, can you hear us now?
Yes, we can.
Yes. Thank you. So the third important platform for us is YouTube. YouTube has become even more critical now because what we've seen in the past 2 years is that the consumption of video as a format has gone up significantly. So be it the smaller video apps or YouTube, they're getting a lot of users. The monthly active users have increased on YouTube, and it has become a go-to channel, not just for people looking for information in English, but even the vernacular language proliferation of YouTube has been massive. The fourth one, and we think that's probably the most important one, is WhatsApp. WhatsApp's penetration in India is amongst the highest in the world, with 400 active users monthly. It is the go-to platform, we're sure, for all of you as well, be it for work or your personal lives. And WhatsApp, hence, is a very critical platform in terms of information dissemination. The fifth and the last one, just from an India perspective, is Instagram. Instagram, while globally again has become part of the whole Facebook ecosystem and is building up its users. Even in India, it has a significant base of almost 45 million now. And Instagram, why it works really well is that it is such a visual first platform, and that's what people love consuming, is anything that is so visual, something that people can look and feel and have a real connect with. And that's why Instagram works great. And Instagram continues to, while it started off as a very urban platform and more with the younger audiences, over the last year, 2 years, what we've seen is Instagram is now also penetrating into your tier 2, 3 audiences, and it is going beyond, while it was dominantly a 18 to 25 kind of user range, but now it is anywhere between a 18 to 35-year-old user range. So these are the 5 platforms that we think are the most important ones for us to talk about today and beyond. Any questions so far? Okay, if there are no questions, what we will go into now is very simply step by step of how you can all get on social media and how you can support us as well. Yeah.
So we will now take forward how to use Facebook. So for the first step, for setting up a profile is to click on your web www.facebook.com. So we will request you to, as we are going forward, you can do this simultaneously while we discuss these steps.
So if we could all open facebook.com on your browser, if you're already not on Facebook, we can take you through the steps. So if everyone's on facebook.com, once you open that page, you will see create a new account button there, which is in green. Once you click on create new account, it'll give you a small form to fill up. It's very simple, just to put in your email ID, your date of birth, and a few other parameters. Once you've done that, what Facebook does is it'll send you a verification code on your email ID. It's a very basic step just to make sure that your email ID is legitimate, and that confirmation code will then open up an account for you. If anyone wants any more information or any guidance on the steps that we're talking about, please feel free to drop it on the chat.
Please let us know if you have received the 6-digit code on your email ID or phone number. You can let us know by sharing with thumbs up.
If there are no more questions, we can move to the next step.
So once you add the 6-digit code, it will automatically give you the insight and to add your email ID, and you will get on the landing page. Your profile is set up. Then it will ask you to add your picture. I think for the Facebook, it's clear, it's pretty simple. These are 5 steps to set up the account.
It's the same. If you're more comfortable using it via your mobile, you can download the Facebook app from Play Store. And once you download, the steps are the same via the app as well to make a new account. All you need to make a new account is either your mobile number or any email ID that you have access to. No, it hasn't changed. इस पे लाएंगे ना.
So once you have set up your Facebook profile, there are certain steps, you know, how you can like, comment, or share post on Facebook. You will see the start post where you can add any picture that you have on your mobile phone or on your computer.
We'll show you an example from one of our profiles.
So there's this on your feed, you will see what's on your mind. So you can click on that.
You'll have to reschedule PPT off करना पड़ेगा.
Stop sharing.
Share your web browser.
So once your account is open, you can click on what's on your mind. And then you will see this particular dialog box that is open. So from here, you can write like whatever post you want to add. If it's like, good morning, you can add it here and then add a supporting image with it. So once this image is loaded on your screen, then you can post from your feed.
So this now comes up on your, what we call as your wall. So anyone who's your friend who is following you on Facebook can see this now. One more thing that you can do, which is very important, is for if you want your friends to know when you put it up, for them to see it, there's something called tagging people. So on the image, what you can do is write names of your friends and tag them so that they know that you've put up something and that you're remembering them or you want them to see it as well.
So in this case, what we will do is we will add Ayushman Bharat handle. So this is one of the regional pages, that is Ayushman Bharat HWC Tinsukia.
So the only thing that you have to remember as a rule, if you want to tag someone, you have to put the character @ and then type out the name. Then Facebook will show you that page that you can select and tag. I hope that's clear. Just putting the character @ and then either writing your friend's name or the name of the health and wellness center or any of your colleague that you want to tag.
Then you can click on this button, save. So you can see ABHWC Tinsukia, this has come up. We have tagged this particular page.
So now HWC, which has been tagged, can also now see it that they've been tagged. They'll get a notification. And in reverse, what they can do is if they like the content, they can also reshare or like it. Yeah. Yeah. We'll now show you what the Ayushman Bharat Health and Wellness Facebook page looks like. So if you all have a Facebook profile, what we would request is if you could open your Facebook pages, and we then want you to go to our ABHWC Facebook page.
You can go here and there is an option, search Facebook.
So if you go to the top left corner, there is a small search box. in the search box, we just want you to write Ayushman Bharat Health and Wellness Centers.
This is the official page for Ayushman Bharat Health and Wellness Centers. So you can click, this is clickable link. You can click here and this is the page which has come up. We would request you all, there's this option for follow. So now that you are on the page, you can click on the follow button and then you can start following the official page.
Any questions so far? I hope everyone's been able to find the page and find the follow button. So once you've started following, our request now is that since you're following this now, every time we put up something, you'll be able to see it on your Facebook page. And our request then is to please like the content that we're putting up on a daily basis. Feel free to repost and reshare. And we'll just show you how to repost and reshare any of the content. So for any post, what you'll see is a box at the bottom of each creative where you can like, comment, and share. Those are your most three important buttons. So like lets us know that you like our content. Comment, you can leave any of the, if you have any feedback or any point of view on the content that's gone up. And share is the button that once you click on that, you'll get a drop down where it says you can share to your feed, to your story, to your friends. I think the second is the only one that you should remember, which is share to feed, so that then you can share it with your friends and families.
And once we have shared this particular post or any of our posts, you will see on your profile that this post is shared from Ayushman Bharat Health and Wellness Centers. You have shared on your profile.
So Facebook, I hope everyone's clear. It's pretty straightforward. It'll take you 2-3 days to get really comfortable. Don't be scared of experimenting with buttons or clicking stuff. There's no harm in anything. And once you're comfortable, like we said, follow our pages. We put up content every day, sometimes twice a day. Please feel free to reshare it ahead with your peers, with your colleagues, with your friends and family. Let's go back to the PPT.
So now that we are done with the demo for Facebook, we will go to the next platform, which is Twitter. So we'll go step by step on how to set up a Twitter profile. So the first step is to click www.twitter.com. Or if you're not on web, you can also download from Play Store, Twitter, and then install the particular app. So just give a thumbs up if you are there on Twitter page or downloaded the platform.
So for Twitter, I think one important thing while registering for Twitter is make sure it's the number that you have access to or the one that you use on a day-to-day basis. Twitter identifies or verifies you as a real user basis an authentic phone number. Again, the steps to register on Twitter is very simple. You click on set up your profile. You can do it via your phone number, email ID. And again, very simple thing in terms of filling up basic things like your phone number, your date of birth, so that it verifies that you are above a certain age. And it will let you choose a password, and it's as simple as that, that your Twitter profile will be set up.
Once you have added all your details, it will tell you to go on the next, and then the step 4 is to add your password. So once these details are added, it will take you to this step, pick a profile picture. Once you've added your profile picture, the next step will be to describe yourself. So it is a simple information like you would want to add to your profile, your bio. If you are a professional, a student, CHO, ASHA, so you can add it in your bio. Once this is done, your account is created and it will take you to your profile. So this is how your profile will look like. Step 7 and step 8.
We'll show you an actual profile so that you get a better. So if you can see on the screen, we've shared a Twitter profile. This is what it looks like. On the left side, you have some buttons in terms of home, explore, notification, messages. But I think the most important one for you is the middle column, which starts from home, what's happening, and it gives you all the Twitter accounts that you can follow. So again, we'll take you through how to post and how to follow us on Twitter. So in terms of if you want to write anything on Twitter, if you see the left side blue button tweet is what you click on, it'll open up a small box, and that's where you can write anything that you want to in terms of message. So you can write good morning, and then there's small buttons on the bottom which allows you to add either a picture or a small emoji as well to your messages. So if you see, we now have a message and we clicked on the first bottom left button for the image and the image has been added. Once you have your message and your image, you can see, you can simply click on the bottom button, which is tweet, and then it will go up. Additionally, what you want to do, same as Facebook, if you want people to know that you've put up something, same thing here is that you can tag people. So it gives you a small option after your image or video has been added, which says tag people. So if you click on that, it'll open another box where you can search. So say we want to search for Ayushman Bharat Health and Wellness Centers. We can search that, click on them. So if you keep searching, it'll give you options. You can, if it's anything related to your field of work, you can tag the Ministry of Health, which is at MOHW_India. You can tag us as a Ayushman Bharat Health and Wellness Center. So you can pick about whoever you want to tag, add it, and click on tweet. Also, what you can do is do something called hashtag. Now, to simply say what hashtags are is the way some of these social media platforms work is if you put a hashtag and a word against it, if you're using that hashtag and anyone else is using the same thing, it becomes part of a conversation stream, to very simply put it. So if you see on any day, there's certain trending topics that people talk about, ki aaj Twitter pe this is trending. So the way the platform can say something is very high in conversation, if anyone's using that hashtag and say if 1,000 people or 5,000 people are using that hashtag, everyone gets to know that this particular topic is the one that everyone's talking about. So if you see, once you tweet it, the post goes up.
This is the Ayushman Bharat Health and Wellness Center that we have tagged. So you can click on this and it will redirect you to the page, to our Ayushman Bharat account.
If we can request you all who've managed to make their profile or are already on Twitter, if you could go to our Ayushman Bharat Health and Wellness Twitter page and follow us there, so that every day when we put up content, you'll be able to see it on your Twitter.
So drop a thumbs up in the chat if you are able to, or you have started following us and created your account.
Again, same request. We put up content almost on a daily basis on Twitter. So once you now start following us, you can see what we post. And it's pretty much the same thing as Facebook. Like we said, any post that goes up on the bottom below the creative, what you'll see are small little buttons to either leave a comment, to reshare, which is the 2 arrows that you see. So if you click on that and click on retweet, then it goes up on to your account as well. And then there's the heart button, which is to like the content that we are putting up. So our request is to at least once a day, if you could come to our pages, look at the content, and help us drive the engagement by either resharing or liking the content. That would be very helpful.
So on Twitter, we put out posts on Hindi and English as well. So you can scroll and you can see there are two pieces, like for the same post, there is English and Hindi one.
Questions specifically to Twitter that we can help answer or deep dive into for you? So just on Twitter, just to round up, is again, same thing as Facebook. Feel free to explore. Don't be afraid of the buttons or the things out in terms of the navigation functionalities. The more you explore, it's a great platform. What you will discover is while a lot of ministries are on there, a lot of great content that even the Ministry of Health puts out every day. Great to follow that. There are lots of news channels like your Aaj Tak, India Today, CNN, everyone's on there. Feel free to look at their pages, follow them. So, you know, the more you explore Twitter, the more you follow such pages, it can become your news feed. So in the morning, if you open your Twitter app, you can get all the news updates for the day from the various ministries you follow or any of the media channels you follow. So it's a great way to get, you know, what's happening in India and globally in a one single app. So we've seen one comment on YouTube where someone is saying that we use Kannada and English. So just to give you a quick context, while we've started, we're only doing English and Hindi content as of now. I think when we talk about the whole ambassador program that Dr. Tarna said we'll touch upon, we're definitely looking at your support to help with regional content. So we are happy to put up regional content. We'll just need a little help from you to get that in from, you know, from your centers, from your districts. And we're happy to, you know, in the coming months, explore more regional content that we can put up for you all.
The next platform that we will now discuss is Instagram, how you can set up your personal profile. So the first step is to type www.instagram.com, or you can go to Play Store and download Instagram app. So once you have reached the page, then click on the certain that is given, like mobile number, email ID, your name, username, and then you can add your password.
The good thing about Instagram is that it's part of the same company as Facebook. So if you already have Facebook, you can just go in via Facebook. So again, the steps are very simple. If you log in from Facebook, you won't be required to refill all information. But in case some of you want to start it from scratch, all you need is your mobile number to put in a username password, and it'll ask you for very basic information. Again, all social media channels will ask you to confirm your date of birth, and then it'll give you a confirmation code either on your Gmail ID or your mobile number, depending on what you've put in. And then once the code comes in, you're on Instagram.
So once you have created your account, this is how your account will look like. Just share our screen. So this is the official ID of Ayushman Bharat, since we have posted a couple of posts from our handle. So you can go just type Ayushman HWC. You see the search here. So you can type a username.
So just on search, if you could type Ayushman HWCs, you will land on our page.
If you have an already existing account, you can also just search here, and this our account will come on your feed.
Again, here we're requesting everyone to follow us. It's the same thing. Once you start following us every day on your Instagram account, you'll see when we put up posts at our end. It's the same mechanism for liking, since it is very similar to Facebook. When you see the post on your channel, or if you go to our channel, there's a heart, there's a comment, there's a small share little arrow. So you can either share it ahead on your page, or you can like the content that we're putting up. So if you could see, this is how your personal page will look like. Instagram, there's a small search button. The top is where it'll give you people who you follow, so what they are putting up. And if you scroll down, the friends, family, peers that you start following will show up. So say even for, I've logged in from my personal profile, what's coming up because I follow Ayushman Bharat Health and Wellness Center on Instagram. For me, what we've put up is showing. So the most recent post shows up. So what I can do is once I see it on my Instagram page, I can like it, I can leave a comment, or I can reshare it ahead with any of, on my feed. So it's very simple again to follow and to like the daily content that we're putting up. Anything that we can clarify or help you with? Yeah. So what we'd like to do now is take 10 minutes, give you all some time and space to either via Facebook, Instagram, or Twitter. Why don't you put up something, put up a picture of your center and tag us? Let's do that activity. Let's take 10 minutes, try it out. We're here. Please ask us any questions while you do that so that we know that you're comfortable and have understood how to do this. So let's take 10 minutes and we're here. Please feel free to unmute yourself in case you have any questions while you're doing this.
In the chat, we have just shared our usernames for Twitter, Facebook, and Instagram. So this will be easier for you to add our handles, pages, and then we can see who all have posted any picture from their profile.
So if you want to tag us, all you need to do is you can copy paste from the chat from @Ayushman. So if you do that, it'll be easier for you to tag us.
उसमें लिखा ही बस ना you are muted. And
Thank you, Ritesh Kumar. We just saw you have posted. We'd just like to tell you that since the post is there on the profile, only thing missing is the description. We only see that you have tagged Ayushman Bharat Health and Wellness Centers.
With the picture.
Yes.
So what would be helpful is maybe you can also give a one sentence description of what this is about. So maybe you can say, I think what we can see is something around the blood donation day. So if you could give a one-line description of what this is about, it always helps the person seeing it to understand, since, you know, language usually becomes a barrier to certain things. But otherwise, how you've tagged and all is spot on.
Ma'am, your voice is not audible.
So if everyone's now comfortable and has gone through or created social profiles, happy to take any questions. Otherwise, we'll move on to the next part of the presentation. Ritesh, thank you so much. What you've done now is perfect. So thank you, everyone. If you've given this a try and are getting the gist of it, we'll move on to the next part of the presentation.
So now that we talked about how you can create your profile, there are certain things while uploading your picture you can keep in mind that you know the picture is so just to catch up the things that we discussed, these are the certain things and pointers you can do when you have set up your Facebook, Twitter, and Instagram account. So the first step, as we discussed after adding your description, was to add your cover image that is on Facebook and Twitter, and on Instagram, your profile image.
So these are basic steps. Some you should follow more from just making sure that your account is seen as credible and authentic. So having a profile picture, and this is something you can quickly take from your camera, put it up, always helps. Also for people, you know, your friends and family, for them to also know for sure that, you know, it's your account. Cover image, while for your personal account, is not that compulsory, but you can do it. And when we say cover image, this is the rectangle box that you see just behind your circular display picture. So if you see the screen, the screen here, what we mean by cover image is the image that you see on the top, which is the rectangular one behind the circular. So circular, the round one is where your picture can go in. So a passport size picture, and the cover image, what we call, is the one behind it, where we are talking about leave no one behind. So for your personal account, it's not that compulsory, but in case any of you now are planning to make an official account for your center, for your district, we would highly recommend putting up a nice creative that talks about the Health and Wellness Center and what the initiative is all about. So say what we've chosen is Health for All, and we've made a little image with the right ministry logos. What you should also do as a third step is what you should also do as a third step is put in a little bit about yourself. Again, helps build authenticity in your account. So it doesn't have to be very long. You can just maybe write down your professional credentials. Even that will do. Once you're in Facebook, Twitter, it allows you to also it allows you to create a username that you can personalize for yourself so that people can easily search you. So say, usually what the system will automatically give you is a name that is a mix of letters and numbers. So you can go into the settings of these pages and set your own name. So you can say on Twitter, I want to be known as @CHO of XYZ place, or by your first and last name. Even that will do if you want to keep it personalized.
So once your profile is created, and how we discussed and we were talking, like you can share pictures of your team, what are the initiatives taking place at HWCs, and if there are any topical days, so you can put that from your profile and tag Ayushman Bharat Health and Wellness Centers. So these are the simple and things that we want you can share with us. Community gatherings, if there are event celebrations, the topical days, now that World Blood Donors Day. So if you want to share those pictures as well. Now that Yoga Day is also coming on June 21st, you can share these pictures with us. You can post on your feed, your Twitter, Facebook, and Instagram. Use the hashtag World Yoga Day and also add a primary hashtag, which is AB_Health and Wellness Center.
The only request that we have from all of you is when you're using your profiles in a professional capacity of taking pictures from the Health and Wellness Center, is to make sure that if you're clicking pictures of any patients undergoing treatment, or them talking about the service that they've got, is we just need you to take their consent. Tell them that we're taking this picture, we want to put it up on social media, because I think that's, with digital laws, it's very important for people to consent to being showcased on a public platform. But this is something that we can go into detail. The NHSRC team here has a few letters and formats that they can help you out with. So this is something you can reach out to us one-on-one after this presentation, and in the coming days. We're happy to share that consent guidelines and SOPs, how to go about it.
So while you are clicking the pictures, these are the certain things you can keep in mind. Like when you are clicking, please keep that in horizontal, that is in the rectangular format, so that everything, is captured and we can have a broader sense and perspective of what the picture is posted. So when you see a vertical image, a couple of things, get cropped, and some of the things that in this particular image is not visible. So the next step and the next thing that you can keep in mind is that the subject, what you're clicking, if there is any screening or wellness session going on, it is at the center. If you can see, there's this one ASHA worker during the immunization sessions. So this particular subject is at the center of the image. And we also request if you can share the solo images, the single images, apart from sharing in collage. The next step that you can follow or also keep in mind that there is a proper sunlight and images are not dark. There is ample sunlight or even the artificial light.
Also, what would be great is if you're clicking pictures at the center, if you can get the building or something in the background, so that it gives a, even in the background, it gives that feeling of, of a health and wellness center. That would be really great, but it's not compulsory. Like Astha said, I think first and foremost is to make sure that you're shooting it in landscape and the light is correct, so that the pictures aren't dark. Your people are at the forefront and their faces or the service being given to them is clear. And same thing for people, if you're, with your team, doing an on-ground activity or going door to door, again, just make sure that the light and the quality of the image is good enough. I think that is the best starting point to clicking pictures. Also, just one more thing, while COVID is still on, it would be great when you are clicking pictures, people are still following COVID appropriate behaviors at the Health and Wellness Center. So do ensure that if you're clicking pictures, people are wearing masks and all those basic steps are being followed, since we're still following those protocols. And even on social media, we want to show that, we are being very careful at our centers.
So for videos, since while you're sharing the videos with us, we would suggest you keep your mobile phones or whatever device you're using on a tripod, or if you're shooting with your phone, so that it is stable. It is not shaky. Otherwise, there will be pixelations in the video and it might affect the quality as well. If you are taking beneficiary stories, so make sure there is no background noise like horns or people talking. So please shoot that in silence or a place where there are very limited noise. To make sure that the video is clear, you can wear a headphone so that you can also hear the video or a beneficiary talking about it. And if this is clear for everybody, or when you are sharing with us to listen.
Also, when we say videos, it does not necessarily have to be something that's very long, or you have to do minutes and minutes of recording. Even short things work for us as content that we can put up on our Facebook, Instagram pages. So even if it's a 30-second recording, that's great. And you can do various versions of it, of just someone at the clinic getting a service. If you're doing a camp, just if you could do like a full 360-degree of just showing that camp and people availing service, and these don't need to be very long. So even short videos work. In fact, short videos work better on some of these platforms. Only on YouTube do you do long videos, but if you're doing it for your Instagram, Facebook, Twitter, short videos just giving a gist of what is happening work well as well.
We noticed that Ritesh Kumar has created a group on Facebook. So we will request if you can unmute yourself and tell from which state you are and how you have created, so that others who have joined the call can also make sure they have also, or they can also create their groups and how they can join the groups.
Thank you, ma'am. Namaskar. This is Ritesh from Odisha, working as state communication manager here. Am I audible?
Ritesh Kumar, we would request if you can speak a little louder because we are unable to hear your
Am I
voice.
audible? Am I audible now?
Yes, it's a bit faint, but if you can speak a little louder.
Yeah, actually, I am trying my best. If I I can say.
Yes, it's a bit faint, but if
Actually, there is some network issue over here. So I think there is network issue. So if
Yes,
hello.
Mr. Ritesh Kumar, you are audible now. Clearly audible. You can go
Thank you,
ahead.
ma'am. Thank you. Myself, Ritesh Kumar, working as State Communication Manager in NHM Odisha, and we are here a group of staff working exclusively for communication, ICPCC. And here we have developed this social media platforms. There is a platform called Health Communication Behavior Change in Facebook, which is created, I think it is in the year 2014 perhaps. I couldn't remember the exact year. But since that time, we are regularly updating our data, like some creatives on different issues like malaria, dengue, diarrhea. Whenever there are some issues arising during COVID time, also we shared our COVID prototypes, COVID creatives, and there is also another platform created by our Health and Family Welfare Department centrally. It is being managed by some export agencies, but still we have a platform which is created since before that. So this platform we are using and using for popularizing our schemes also. The schemes like our Ayushman Bharat, we can add these things, and our schemes like BSK, Biju Swasthya Kalyan Yojana, all these are incorporated in these platforms. And also we have a Twitter account. We have actually we are not so much frequently using the Instagram, but in Facebook and Twitter we are active, and our messages regarding behavior change schemes and other related health activities are regularly updated, which you can also add chip in our platform to see what are the various activities has been undertaken. Thank you.
Thank you, sir. We'll definitely follow and share your content on our HWC channel. And if there is anything that you do regarding behavior change communication in health and wellness centers, please feel free to tag us on your Facebook account.
Thank you.
And share them in, please share your number. We'll create a WhatsApp group and we'll add you there so that you can send us links and we can send you content.
Okay, ma'am. Right, ma'am. Thank you.
Okay, sir. Sir, Odisha from state level or district level?
Actually, this is a state level platform.
Yes.
Where all the district level officials are also added, and other public also added, and some other departments officials also added. This platform is a multi-sectoral platform where everybody are invited. Even out of India, people are also joining in our group to learn, and we are also allowing them to add in this group.
Okay, sir. Okay, sir. Thank you. Please share your contact details. We'll get in touch with you.
Okay, ma'am. Thank you.
Any other state want to share their experience? Can we hear from any other state? Nagaland, we have Nagaland here. Can we hear from Telangana if they have a page or are they active on any social media?
Telangana responding, madam.
Yes, sir.
Yes, madam. We are in Facebook and Twitter. We have accounts, madam. Remaining, we'll plan to open all from all centers from state level to HWC level, madam.
Yes, sir. So please write your handles on the chat box so that we can keep them in our repository. And if there are any pictures that you have of health and wellness center or we have, so we can tag you appropriately.
Sure, madam. Sure, madam. Thank you.
Thank you, sir. Anyone from Andhra Pradesh?
పెట్టవచ్చు కానీ అది దాన్ని తీసి పెట్టాలి.
ఫ్యూచర్లో అంటే రావాలి కాలంలో
Anyone from Andhra Pradesh?
Hello?
Yes.
Yeah, ma'am, I'm Paul. I'm from Andhra Pradesh, Asha team leader.
Yes, sir.
Actually, I don't know, ma'am, about social platform accounts. So recently I'm joining. So I will update you, ma'am, as soon as possible. Okay.
Sure, sir.
Thank you.
Thank you. Anyone from Ladakh? Maharashtra? I see Maharashtra raising their hand. Maharashtra?
Ladakh here.
Yes, yes, ma'am.
Yeah, we have a page, official page, which has been recently created. So we don't have much experience as of now, because we have been done this recently. It's been a month or two only. We will share the link details with you also, and we will definitely keep you updated henceforth.
Yes, ma'am. Please share
Thank you,
your
ma'am.
details, your contact details, as well as your page details on the chat. We'll keep them in our repository.
Sure, ma'am.
Yes. Maharashtra, sorry, you were speaking.
Yes, ma'am. We have also created Facebook, Twitter, and Instagram page. We will share the link. Please share and comment on the post we are sharing. Thank you.
Yes, sir. Please share your links on the chat, because there are multiple pages by Maharashtra and other states. So it becomes difficult for us to track the correct page. So if you follow us, we'll be able to find you, and also write your handles on the chat box here.
Okay, ma'am. Thank you.
Yes, sir. Any other state who wants to probably Manipur or Lakshadweep? Any other state, Lakshadweep or West Bengal or Manipur? Okay, if there's no, we can take up questions and continue this discussion at the end of our session. Okay, I see Lakhimpur district level profile here. We'll keep your post. We'll keep your page handy, and please do follow us so that we can also tag you. Okay. Ladakh, please share your ID as well, and Maharashtra also. And we can continue with our orientation. We have a few more things to discuss, and then we can again go one by one with the states. Astha, you can continue.
We discussed on how to click the pictures. We are also sharing visually while screening or services that are happening at HWC. So please ensure that COVID protocols are followed, and ask the beneficiary as well, or the services which are taking place, to maintain social distance, and even they are wearing masks, and that the HWCs are also not overcrowded. While taking a video, it would be great if you take the videos with the background of HWCs. So if your health and wellness centers have these 6 circles, and if the background is of yellow or whatever the color of the building is, and if HWC is written at the top, that would be great while shooting a video. If you have any questions how to shoot a picture or even a video, please let us know. Bringing back the conversation, like when you're taking a beneficiary story or clicking a picture, please ensure that you have the consent. The forms will be and the details will be shared by the NHSRC team. So you can please keep this in mind while you are taking the pictures. And once you share these images and your testimonials, this is how we publish from our platform. So these are just as samples.
So when you share images with us, either you put it up on your pages, tag us, we'll take it from there. But even if you're sharing it via email or WhatsApp with the central team here, what we would want to know with regards to the beneficiary or is what we would like to get as basic information is name of the person, what is the location of where this image or video has been taken and at which HWC. So like if you see on the right hand side, how we use it is what they've said, we make it into a quote, and then we also then give their name and location as description so that people on social media know who they are, where they're from. And the reason for doing this is to make sure that the people that we are showcasing are authentic and credible. So this is just a roundup of what we've spoken till now. So what we want, yeah, just give us a minute. We'll get to this. So a quick recap of what we want to share, what we've just said, but just listing it down as a rule of thumb that everyone needs to follow is that we want good quality images, and that images should have description, which is who the person is, where they're from. Make sure now that you all know how to be on social media, what to do, open your social media pages at least once a day, see what we've put up on our HWC handles, please engage with it. What we want more from all of you post this workshop is to start sharing more stories with us from the field, from your health and wellness centers. What we also request the state teams to do is let your other teams know that we are doing this exercise. Please, percolate this exercise or this workshop to them and what the whole objective is, so that we can start getting in more images from all the other centers, and train your teams accordingly of what you've learned today in terms of how to take images, what type of images we want, so that we can start building this whole database where we have great pictures and great stories to talk about. We've spoken to you about how to tag, so anything that you're putting up on your personal page or via the official accounts, please tag us on Ayushman HWCs. Also use the hashtag like AB Health and Wellness Centers or tag us. Hashtag maybe not, but do definitely tag us when you're putting up anything related to health and wellness centers. And what we spoke about briefly was local languages. While we right now focus on English and Hindi via the main account, we do want to start doing more regional material, and we're looking for support from your end to share material with us in local language with your local beneficiaries or your local colleagues being featured. Just a quick roundup of we spoke about our three main social media platforms that we're on: Twitter, Facebook, and Instagram. Just a quick recap of the handles that you can type in search, look for us, and start following us.
Just for the reference, these are the snapshots of a profile. This is the Twitter profile, Facebook, and Instagram. Now we will request the NHRC team to take over the social media sathis and discuss with you how you can create or be a youth ambassador.
Yeah. So, thank you, Astha. We'll now be introducing this concept of social media ambassador for Ayushman Bharat Health and Wellness Center. For this social media ambassador, we aim to nominate two people. We ask the state nodal officer, HWC or IC to nominate two people from each of your Ayushman Bharat Health and Wellness Center and the community. So one of them can be any user of the ABHWC facility, and another can be a JAS president, Jan Arogya Samiti president, if in case the Jan Arogya Samiti is formed at the Health and Wellness Center. So now how can a state identify who can be a social media sathi? So how can a state identify who can be a social media sathi? So any active member of ABHWC, preferably who's a community platform member also. So probably a VHNC member or a MAS member or a JAS member if the JAS is formed. Those people are preferred. Second, please ensure that the person has smartphone and is in social media platforms and is interested in social media, may it be Facebook, Twitter or Instagram. They should have presence in Facebook, Twitter or Instagram. If they have not created an account yet, they can create that account. And they should be willing and enthusiastic about creating content for health and wellness centers. So this is an initiative that we are taking at the Ministry of Health and Family Welfare level, where every health and wellness center will have their social media sathi who will help propagate the Ayushman Bharat Health and Wellness Center agenda, and also create awareness about the services which are available at Health and Wellness Center and the Health and Wellness Center team. So, what will a social media sathi or a social media ambassador will do? First of all, these social media sathis will follow us on Ayushman Bharat Health and Wellness Center across the platforms. They will share on their public platform our content. We will encourage these members to follow us, repost our content. They can also share if there is some calendar day, like for example a few days back it was blood donation day, then yoga day is coming up. So any activity that is happening at the Health and Wellness Center or any wellness session which is happening at the Health and Wellness Center, these social media ambassadors can click pictures, create videos, and share with us. These pictures we can then reshare or repost on our social media handles. Yes. So now, how can you become this social media sathi? So there is this Google form link that we will share in the group. That we will share in the group. We'll quickly open the link. Can you project the link? Yes. So this link, this is a very small 5 to 6 questions social media nomination link that I will request all the people here at this meeting to share with your health and wellness centers. In fact, all health and wellness centers of the particular state. The questions are very simple: your email ID, your name, the name of your health and wellness center. And the fourth question says simply that are you a beneficiary or are you a Jan Arogya Samiti member? Third question is the village name. Village name, the block name, the district name, state name. Your phone number is something that we need. Your Facebook handle, Twitter handle, and Instagram handle. It is a very simple form that we will share here in the group now. You can share among your health and wellness centers, CHOs, medical officers, or yeah, you can just check. Vidhi just shared the nomination. Please share it among your peers and health and wellness center team. And this link, can we go back to the presentation? Yes. So this link we have shared with state and the district people. Those are here in the chat. We could not share it with the people that have joined us via YouTube. So I'll request all the states to please share this number or share this link over their WhatsApp groups. To summarize, two representatives per ABHWC, one being a Jan Arogya Samiti president, if Jan Arogya Samiti is formed, and another being a user of ABHWC. Any person who's an avid social media user has handles on on all of the three accounts and is willing and enthusiastic about sharing our content. And the timeline for this, please keep in mind that we'll close this Google form by 30th of June. And what we plan to do is we create WhatsApp groups of the people who have registered as social media Sathi. Dr. Prabhat here says the CHO can be a member. Yes, definitely. CHO, if they want to be, they can definitely be a member. They can fill up this form and be a member. And yes, any query? We have someone speaking from West DPMU.
Ma'am,
RB Anglong.
class is not formed. Shall we take one representative from the RKS committee?
Yes, ma'am, definitely.
Okay.
If JAS is not formed, RKS committee or any beneficiary of ABHWC will also help.
Okay.
So yes, as I was saying that once we receive nominations from all the states and union territories, we'll create WhatsApp group subsequently, and all our social media content, their content for our social media, there will be exchange of content, and we'll they will be active users. So what will be their benefit? If I say, first benefit is they will be the first pass of receiving any content that we share, we or the ministry shares in terms of Ayushman Bharat Health and Wellness Centers. They will also have the opportunity to attend future capacity building sessions. Their content will be their content, their click pictures, videos will be given preference for sharing in ministries and health and wellness centers page. So yes, now we can have a round of questions from any state. Any question? DPMU West Karbi Anglong. Any questions from any state? Any state wants to provide their experience of social media? We have Arunachal Pradesh. We
Hello.
see, yes,
Digital.
yes.
Yes, this is Dr. Pravat from Sikkim.
Yes, sir. Please go ahead.
Yeah, we have a social media platform on the WhatsApp. We have a dedicated group for health and wellness centers and CHOs, and also we have eSanjeevani groups. Also on Facebook, we have a dedicated Facebook group for Health of Sikkim, which is run by the handle Health of Sikkim. On Instagram, we are yet to create our handles, and so on. We are going to do the work according to the social media what to say guidelines.
Yes, thank you, sir. We request that whatever handles that you have, we will share it on the chat. And somebody wrote that is it necessary that a public personality can only be a Sati? No. Any, like I mentioned, anyone who's a user of health and wellness center services, a CHO, a medical officer, anyone, or a person who often visits health and wellness center, is a patient, or is an avid user, avid social media user, can be a social media Sati. Yes, the CHO can be a social media Sati. CHO, medical officer, anyone who's interested. DPFU West Karbi Anglong, do you have any query? Do we have someone from Goa? Do we have anyone joining from Goa? Yeah, anyone from Andaman? Ms. Dr. Prabhat, on your question, one from each HWC, please nominate a CHOMO. That will be fine, but we prefer only one person. Anyone from Andaman? Yeah, so Ritesh Kumar, sir, on the benefits of social media, Sati, like we mentioned that their content will be given preference over for their content will be given preference for our posting, because we post a lot of field pictures, testimonials, videos, especially on the days of health calendar days. Their content will be used. Second, any information that has to be shared on social media of their respective page or a state page or our page will go through the social media Sathis, and will also be orienting them on regular basis. Regular capacity building will be done for them. So these are the few benefits of being a social media Sathi. One thing I can say is they will not be like, they can be on rotation basis. If somebody else is interested after a few months, they can also pitch in. Anyone from Lakshadweep? Yes, so yeah, so Poorbali here says that we have Twitter and Facebook accounts for all districts in Assam, which are handled by district media experts, where we are posting our activity, and HWC program is also highlighted on social media. So can these already existing social media handles used as such? I suggest that yes, they can be used. We will just request them to share their details on the Google link that we have, because I understand Assam has a lot of districts. You cannot name all the handles here, so we'll request they can add in the social media Sathi. Also requesting the health and wellness centers to be also added, because we want to reach to the field, get direct field pictures. So apart from the district media experts, uh, the health and wellness centers should also get these links. Should this, yes, district pages can also tag health @ Ayushman Bharat HWC. Please inform the district media experts to tag us, that is at Ayushman Bharat HWC, while posting anything. APHWC says, should this Google link be shared to all HWC users? Yes, you may. No, HW, yeah. Yeah, you can share it with CHOs. Okay, any other state? Yeah, any other state who wants to say something? Kerala? Any queries from Kerala?
No, ma'am. Actually, we are
Yes.
dealing social media as a good reach in Kerala because one of the most engaging social media handles we are operating in Kerala, like Facebook and Instagram. Everything is actively doing daily updations and everything. One of the things I think we are not much more important about the Twitter handles, but nowadays we have started to think about updating Twitter handles also.
Okay, so that is great to hear. So we are not aware of NHM Kerala's handle. I'll request you to please write your handle in this chat.
Yeah, sure, ma'am.
We
Actually,
can quickly follow you right now. And please, if there are any posts that you have related to the health calendar days, like a few days back, it was blood donation day. In some days, we'll have yoga day. Please tag us at Ayushman Bharat HWC so that we can also increase your engagement.
yeah, yes, ma'am, sure. Because we have a state page, and apart from we have 14 pages in districts pages, and parallelly we are updating state and district. So the information reach directly to the ground level. So we are
Yes.
updating the link of our social media handles. Okay.
Yes, sir. That will be wonderful if you could share us the links. If you tag us, we'll automatically get notification and we can find you.
Yes, sure, ma'am.
Dr. Rupa, somebody has raised.
Ma'am, good afternoon.
Good afternoon.
Yeah, I am Dr. Uttara on behalf of Dr. Rupa. She is busy with some meeting.
Which state, ma'am?
Goa.
Yes.
Yeah.
So, ma'am, do you have a official handle of Goa?
Yeah.
NHM handle?
Yes, we do have a official means the social media, and even our some of the PHCs means most of the PHCs also do have a social media accounts on Facebook and Instagram.
Please do share the links with us. Please do share the links with us, because we were unaware of such channels.
Okay.
To increase your engagement as well as ours, please share the links. And also, if there are any events happening at Health and Wellness Center, feel free to tag us at Ayushman Bharat HWC. Thank you.
Yes.
We'll just wait for 5 more minutes for Goa and Kerala to write their main handle on the chat box. And then probably if there are no more questions, we can close this session.
While they're sharing their handles, just a few things to recap. In the last 2.5 hours that we've been on this workshop call, we've only seen 100 of you like us and follow us on Facebook and Instagram. So the request is, at any point today, please take out 10 to 15 minutes, log in via Twitter, Facebook, Instagram, and please follow the Health and Wellness, Ayushman Bharat Health and Wellness channels on Facebook, Instagram, and Twitter. Please do that. The more reach we have, the more followers we have, only helps get our message across to everyone in the country. So the more you like, the more you share our daily content, it's in all our self-interest and benefit to make sure that our social media channels are a success, and what we are doing at the centers on ground goes across to so many more people across the country. So that's the only final request that we have.
Excuse me, ma'am. Can I speak few words? Hello? Hello?
If there are no more queries, we can close this session. Thank you everyone for participating actively. We hope to see you. We hope to see more of you on our social media channels. Dr. Rupa Nayak, CMO, Directorate of Health Services. Yeah, we have received your handle. Please share the Google link with your health and wellness centers.
Yes.
And thank you for joining the call today.
Yeah. Thank you.
Thank you, everyone. We are now closing this session. Thank you. Have a nice day.